Batten disease and neuronal linkage. Batten disease is not just a storage disorder. It is a story of broken neuronal linkage, the failure of lysosomal clearance, disturbed synapses, damaged brain circuits, impairs neurotransmission, and gradually disconnect the network responsible for sight, movement, memory, and behavior. Hi, my name is Dr. Vas, and today we're going to discuss Batten disease and neuronal linkage. It's an autosomal recessive neurodegenerative lysosomal storage disorder, and which leads to the neuronal death, seizures, blindness, cognitive decline, and premature death. Epidemiology 1 to 3 per 100,000 live birth. Classification from CLN3 1 to CLN14. These are the genes. Clinical spectrum infantile 6 to 24 months, late infantile 2 to 4 years, juvenile 4 to 10 years, and adult less than 18 years or sometimes more than 18 years of age. Key symptoms progressive vision loss, blindness, cognitive decline, ataxia, myoclonus, behavioral changes, motor regression, and ultimately vegetative state. Storage material. Sometimes there is a dysfunctioning of mitochondrial ATP synthase, saposins, A and D within the lysosomes of neuron, forming hallmark ultrastructure pattern. Pre-terminal features: swallowing difficulty, total blindness, severe dementia, loss of all motor functions, recurrent pneumonia from aspiration. These are the genes that are involved from CNN1 to CNN10. The proteins that are involved, the function of the genes, and key features that are due to mutation in these kind of genes. Disease mechanism: serine gene mutation causes autosomal recessive loss mutation that leads to deficient lysosome enzyme, that leads to substrate accumulation, subunits of ATP synthase, and saposins A and D build up in lysosome. Lysosomal dysfunctioning occur that leads to neuroinflammation, neuronal apoptosis, and progressive neurodegeneration or neurodegenerative disorder. Lysosomal storage disorder: autophagy impairment, neuroinflammation cascade in which TNF alpha, IL-1 beta, and IL-6 releases, creating a neuroinflammatory microenvironment that accelerates secondary neuronal death. Mitochondrial dysfunctioning causes due to ROS overproduction and ATP depletion in neurons, particularly cerebral and cortical interneurons. Selective neural vulnerability: GABAergic interneurons are involved, which are related to cerebral Purkinje cells that causes ataxia, epilepsy, and dementia. Neuronal mechanism: GABAergic interneuron loss and epilepsy. When neurons are lost, the GABAergic functioning became static or slow, that causes the epilepsy. Purkinje cell dropout causing the ataxia, motor ataxia. Retinal, ganglionic, and photoreceptor neurodegeneration causes blindness. Complement mediated synaptic pernoding, in which the overexpressed complement C1q tags synapses for elimination. Excessive complement mediated synaptic pernoding beyond normal development refinement strips neuron of their dendritic connection. Impaired lysosome CLN3 is the major gene that causes directly the impaired lysosomal function, lysosomal fusion, blocking mitophagy and protein aggregate clearance. mTOR dysregulation, lysosomal dysfunctioning activates mTOR suppressing autophagy through ULK1 inhibition, resulting in autophagy block, prevents neurons from clearing toxic proteins from the neurons. Genetic testing for the diagnosis, CLN1 to CLN14. Genetic testing should be there in these kind of patients to know which genes are involved in the dysfunction of lysosome. Biochemical testing involves CLN1, EPB1 enzyme, cathepsin D, CSF biomarkers. Neuroimaging MRI or PET should be used to know what kind of disease stage is there. Ophthalmologic studies, ERG, electroretinogram is the test for that. Electron microscopy and tissue biopsy, skin and injectable biopsy should be there in these kind of patients. Clinical scoring and monitoring tool, Hamburg motor and language scale, unified Batten disease rating scale, and neuropsychological battery. These are the monitoring tools used to measure the effect of the lysosomal disorder. Treatment, disease modifying enzyme ERT is underway in some patients in the world. The pharmacological and substrate reduction therapy, miglostat, N-acetylcysteine, immunosuppressive drugs, and cysteamine plus N-acetylcysteine. These are the few pharmacological therapies that are used to reduce the impact of the lysosomal disorder. If the seizures are there, different drugs like valproate, clobazam, lamotrigine, palliative and supportive care, physiotherapy, communication support, nutritional support, and psychological support should be there for the treatment of these patients. Prognosis, early onset, really severe, vision loss, seizures, motor cognition decline, advanced dependence. These are the favorable prognostic factors and unfavorable prognostic factors. That is the summary. And that is the graphical summary of the discussion on Batten disease and neuronal linkage.